Late stages of malignant gastroduodenal disorders and cancer of the head of the pancreas result in gastric outlet obstruction. Gastroenterostomy is a useful procedure for palliation of this condition. This can be performed by open or laparoscopic surgery. The latter is less invasive but is associated with considerable morbidity, with a risk of post-operative complications such as anastomotic stricture and leakage. Endoscopic stent placement, while being less traumatic, carries the risk of tumor ingrowth, stent migration, and stent occlusions. The use of natural orifice transluminal endoscopic surgery, abbreviated NOTES, is a novel technique for creating gastroenterostomy. However, the different ways of performing NOTES are also technically challenging, involving the use of suturing devices or the use of magnets, which is complex, can lead to perforation, and also cannot be used in patients with an implanted pacemaker. Therefore, there is need for a surgical method that is minimally invasive, associated with less morbidity, and that can be implemented in clinical routine. A double-disc occluder design, initially used for treatment of congenital heart conditions such as atrial or ventricular septal defects, has also been used for closure of fistulas as well as in NOTES gastrotomy. The feasibility and efficacy of using an occluder to create a gastrointestinal fistula was investigated by Luo et al. In an animal model. In their paper entitled Transgastric Endoscopic Gastroenterostomy Using a Partially Covered Occluder, a Canine Feasibility Study, they report their findings in a recent issue of Endoscopy. Here is a summary of the findings. The use of natural orifice transluminal endoscopic surgery, NOTES, for gastroenterostomy has been previously reported, but it remains technically challenging and additional assistance is often needed. The aim of this study was to develop and evaluate a novel method for the creation of a gastroenterostomy using NOTES with an occluder. Transgastric endoscopic gastroenterostomy was performed in 12 healthy female dogs using a therapeutic upper gastrointestinal endoscope and a partially covered occluder. The occluder was removed with a snare 1 week later. The patency of the gastroenterostomy was confirmed by endoscopy, contrast radiological study, necropsy, and histological examination after 2 weeks. NOTES gastroenterostomy with an occluder was successful in all 12 dogs. The mean operative time was 32.3 plus minus 10.3 minutes, range 20.3 to 53.5. One dog died 4 days after the operation of severe intra-abdominal infection due to incorrect deployment of the occluder and poor bowel preparation. Minor bleeding occurred at the anastomosis after removal of the occluder in 2 of the remaining dogs. Necropsy revealed post-operative adhesions that had developed at the anastomotic site in 1 dog. No anastomotic leakage or intestinal obstruction was observed. Complete healing of the anastomosis was confirmed on histological evaluation. The authors conclude that gastroenterostomy performed entirely by NOTES using an occluder was technically feasible in this survival animal model. With a shorter operative time, the surgical intervention represents less stress and shorter exposure of the peritoneum, evoking less stress response.